All right, it is a really dangerous trend. Opioid use here in the U.S. is at its highest it's ever been, leading many to call it an epidemic right now.
For people struggling with addiction, it can be really hard to recover. But there's one place right here in the Valley offering some natural alternatives like acupuncture.
The cane toad,
Ryan
that's an
is at Blue Door Therapeutics in Scottsdale to explain. Good morning, Ryan.
Hey, good morning with the great team here at Blue Door Therapeutics. Yeah, I mean, think about this. We have 5% of the world's population in the United States. We prescribe 80% of the world's opioids, and it has created a certain epidemic across the country and here in Phoenix. I want to talk to Dr. Gina, the CEO over here of Blue Door. You guys do a lot of great work, and one of the modalities we're talking about right now is acupuncture. Yes. We have some subjects over here who are going to get involved, and you guys go ahead and show us how this works. But Gina, tell me why acupuncture works for something like opioid addiction.
So the NADA points specifically for AcuDetox were discovered in the early 1970s, and research from the 1970s to date have shown that if you stimulate, there's a 3 to 5 point system in the ear, which we can demonstrate. It really helps with withdrawal symptoms and specifically for opioids. And so it's one of those treatment modalities that is pill-free, that is relatively painless. I know it's needling, which makes some people nervous, but it's really effective. You can see Nikki's doing great here. She's not crying or screaming. It's really not as dramatic as it seems. And then these are actual seeds that will stay in the ear that she can continue to press as she leaves here. And it helps people with withdrawal symptoms, and it helps people feel calmer, helps with sleep, etc. So really effective for some of the withdrawal symptoms that, again, is pill-free, that we like to support the use of here at Blue Door.
When we talk about some of the side effects of withdrawal, how specifically is, I mean, we're looking at her ear. It seems kind of crazy that it could treat something as serious as opioid addiction. What kind of withdrawal symptoms is this helping relieve?
Some of the anxiety, some of the pain. Again, NADA points can be helpful for any stressful or chaotic situation that a person is going through, and it's been effective outside of chemical dependency, but specifically for chemical dependency, it can be really effective for calming and focusing patients, allowing them to participate in other activities in their life so that they're not so focused on what their body is going through. It really seems to modulate what the withdrawal symptoms are.
We have a couple of seconds here. I want to talk briefly. You and I have been chatting this morning about changing an attitude or perception about treatment. We've lived in a pill for every ill society. We do prescribe a lot of opioids in this country, but the treatment, the question of how to treat is changing and still a big question mark. What do you want to see moving forward in this sphere, in this area?
I think that we really established pretty effectively that there's a problem. I want to start talking about solutions. And I think for our patients whose lives are on the line, if we can find any solution that will help them, especially evidence-based solutions such as acupuncture, such as cannabis, such as mindfulness meditation, we want to offer all of those things to our patients, see them through both acute and chronic withdrawal, which is a protracted process. And so we really want to stick with those patients long term.
Dr. Gina, thank you so much. In the next hour, guys, we're actually going to talk about cannabis and the way that Dr. Gina and the rest of the folks here at Blue Door Therapeutics are using cannabis to treat people with opioid addictions, severe addictions being helped by marijuana cannabis products. Much more on that coming up in the next hour. Back to you.
Opioid use here in the U.S. is the highest it's ever been. In fact, a recent study finds that Phoenix ranks in the top 10 for opioid distribution.
And a lot of people are now turning to maybe natural remedies to get some help, including medicinal cannabis. Ryan is at Blue Door Therapeutics in Scottsdale to explain how this is working for some. Good morning.
Yeah, hey guys, good morning. A great team here at Blue Door Therapeutics, and we're talking about opioid addictions, folks who have been taking pills for a very long time and need help getting off of them because they are so addictive. I want to talk to my friend Dr. Gina. She's the CEO here at Blue Door. We were talking about acupuncture in the last hour and how that's helping people who are addicted to opioids. Let's talk about cannabis this time around. It's something that you do use here pretty regularly.
We do. We found cannabis has been really effective for patients who are trying to get through acute and chronic withdrawal when they're stopping opioid use.
And how does it help? I mean, specifically, and I know it's different from patient to patient, but how is it helping them?
Well, THC that's found in the cannabis plant is an effective opioid substitute without using the opioid receptor. And so it's kind of a frontage road to the opioid freeway, if you will, of helping with replacing the neurotransmitters so that patients don't go through the withdrawal or the sickness that they get when they stop using opioids, the anxiety, feeling like their body's turning inside out, nausea, vomiting, insomnia, etc. It helps with those symptoms to get patients through acute withdrawal. And then another component of the plant called CBD or cannabidiol helps with the chronic withdrawal, and those are cravings or helping patients feel more even-keeled. It's anti-anxiety, it's muscle relaxant, helps people sleep. So we use the different components of the plants during different times of the process to really help the patient get through the whole thing.
And a lot of people, when they think about cannabis, they think about smoking a plant, they think about a pipe or a bong or some sort of glass to inhale. But what you're working with here is not smoke at all. I mean,
Right.
these are in pill form, extracts essentially. Tell me what we're looking at.
Yeah, patients don't need to think that they need dreadlocks and tie-dye shirt and listen to reggae to use cannabis. Cannabis has really evolved in terms of the concentrates that are being made right now in the market. And I'll give you a few examples. This is a spray. It's a minty spray. It doesn't taste or smell like cannabis. It's very discreet. And every single pump of that spray is 6.6 milligrams. We know what the dose is.
Interesting.
We know what the patient's taking, and so we can really help them change their regimen if they need to in order to get through the process.
Okay, quickly show me the rest of these real quick.
Suppositories,
Yep.
great for thoracic pain. Listerine-type breath mints that dissolve in the mouth, or strips that dissolve in
Right.
the mouth, capsules. So there are a lot of ways to use cannabis without putting flame to a plant.
Which doctors will tell you they don't want you necessarily smoking anything,
Right.
but there's an extract here. Gina, thank you so much. We appreciate it. And thank you, our wonderful acupuncturist here at Blue Door. Some great ways to go about this. I mean, this is such a big problem in our country now. We need to start addressing how to fix the problem. These are just a couple of the ways that they're using here at Blue Door.
All right, interesting to see how
Hopefully
they're
it
doing that
helps.
there.
That's for sure.
Thanks, Ryan.